Hello, my name is Michael Alwyn. I'm the Specialty Pharmacy Manager for UW Medicine, and I'll be talking today about some interview tips specifically for new practitioners, both for jobs and for residency programs. So some of my background on interviewing, I'm a residency coordinator for our Health System Pharmacy Administration program. Over the last about 5.5 years at UW Medicine, I've interviewed many residency candidates as well as interviewed many new practitioners that are looking for jobs throughout our health system. So my goals for today are just to start off with a little bit of background on how to conduct a successful job search. And then I'll go through some different strategies to prepare for interview techniques and talk about some of the different techniques that you may see in an interview setting. And throughout it all, I'll try and insert how best to plan for the residency application and interview process. So starting the search off, it really starts with you, the candidate. So trying to identify what type of job you're looking for. You've done a lot of work studying through pharmacy school and trying to prepare yourself to enter the workforce and be a pharmacist and provide care. And we all want to look for that ideal job. And sometimes it may or may not be available to us, but try and identify what characteristics of a job that you're looking for and what are some things that you are looking for in an organization that you want to work for and a team that you want to work with. So some areas to find out about these jobs and be able to investigate more job opportunities. You may have some job fairs through your school of pharmacy or through professional organizations. Networking events are an excellent way to find out about opportunities and to speak with people who may be working in that specific area or with that organization. So whether that's at the ASHP mid-year clinical meeting, if you're pursuing a residency, most likely you attended that and were able to speak with a lot of residency programs, but also through the WSPA, the Washington State Pharmacy Association meetings as well is a great opportunity to talk with pharmacists and try and find out what opportunities are out there. And there's a lot of information that you can find just by looking at specific organization websites or association organizations. So both ASHP and WSPA have job listings available, as well as other professional organizations have job listings available if you're looking locally here in the state of Washington or looking across the country. And all of the residency programs, there's a residency directory on the ASHP where you can find more information about specific residency program offerings. And one of the best ways to find out about job opportunities, as well as to learn more about what a job may really look like and how to find out what some of those characteristics are that you're interested in a job, is through your personal contacts. So really asking the pharmacist that you work with as an intern or perhaps your preceptors when you're on rotations, asking more about the places that they've worked or their current job, and if they're aware of any opportunities. Frequently word of mouth is one of the more valuable ways to find out and to get your name in front of the right person when you are looking for those jobs. So let's say you've picked an avenue or identified some jobs that you really want to pursue and apply to and hopefully interview for. It's important to strategize about how you're going to make that first contact. So most organizations have some sort of online application submission. If you're applying to residencies, it's all an online application through the forecast system. So that really will guide you in what information you need to provide as part of that application. So this is the time when you want to review your resume or your curriculum vitae, your CV, and start developing or drafting your letter of intent. So for a residency application, those are required documents that you need to submit as part of your application, so you'll have a formal way to supply your letter of intent. If you're looking just for a job with an organization, there may not be an opportunity to put a letter of intent through the online application portal. So I think one of the helpful things is if there is a hiring manager or an HR representative contact on the job posting, if you reach out to them and share a little bit about what what your letter of intent would contain, right? So try and articulate what your goals are and why you think you may be a good fit for this position and how this position aligns with your career goals. Making that contact and putting a little bit more personal touch to it is a good way to start the process and try and get your name included in the interviews. And then before you interview, it's helpful to contact people that are going to be your references. So almost all jobs will require some sort of reference. So you'll want to identify either people you've worked with or your professors, your preceptors on rotation, somebody who can really speak to who you are as a person, some of the qualities and skill sets you bring, as well as somebody who can speak to the quality of your work. Who's been able to see your work. So it's important to ask those people ahead of time if they'd be willing to give you a positive reference and have those ready so that you can provide those when the time's right. If you're applying for residencies, certainly I think the majority of residency programs will already require 3 letters of reference as part of that application process. So after, let's say you've been offered the interview and now it's time to prepare before that interview time, the first thing you want to do is really try and research the job or the residency program as much as you can. So whether that's through looking at the organization website to see what information they have about the job, speaking with other people who maybe have worked there or worked in a similar type of setting, really trying to prepare yourself and understand what the job requires and what the skill sets are that make a successful pharmacist in that role. You also want to pursue learning about the organization as a whole and really trying to get a better idea of what the pharmacist's role is in that organization and providing care to patients, as well as what the goals are for the organization on a broader scope. So that will help you hopefully learn about the organizational culture and how it could fit and what opportunities it could provide with your career plans. Prior to your interview, most likely you're going to get some sort of interview itinerary, and you'll want to review that to get an idea of who you'll be meeting with and what types of roles they're in. If you don't get an interview itinerary beforehand, I think it's absolutely appropriate to contact whoever you've been working with to set up the interview and ask if they do have an interview itinerary they can provide to you, really to give you, help you prepare to know who you're going to be meeting with and try and prepare for what types of questions you may expect. And finally, it's incredibly important to know you. And that sounds very simple, but it's something that when I've interviewed people, I think I have noticed does get overlooked at times. So really spend some time thinking about both your interests, what your career goals are, what your strengths are that you can bring to that position or residency program or organization. It's also important to take a look back at your experiences and start thinking about the things that you've learned in the different experiences or organizations that you've encountered throughout your time in pharmacy school. Anything you put on your CV or your resume, I would consider is fair game for an interviewer to ask a question about. So make sure that you look through there and you can speak to that organization or that project that you worked on 2 or 3 years ago that's on your CV. So really take some time to reflect on your experiences to help you prepare for that interview. And on the other side of that table, what interviewers are looking for, rather. I think when the CV or resume is reviewed, that's really the time that interviewers are identifying competent and skilled individuals. So making sure that you have whatever work experience or rotation experience or learning experiences that the interviewer is looking for in that position. So that really should be done before the interview, or at least I certainly try and get that done before the interview. And then when you come on site for the interview, one of the things that people always refer to as fit. And that's a pretty abstract term, but I think in general, I would just describe it as looking for somebody that will work well within our team. So somebody who can identify with our goals and the position would line up with that person's particular interest. And the reason why I think it's important from the interviewer side, to make sure that the candidate's interest matches up with what the position has to offer, is because we know that the candidate is going to be more successful if that position does align with them. Nobody really wants to put somebody in a position if we can predict that they're going to be unhappy or feel unfulfilled. It doesn't benefit either party. So we're really looking for that, to make sure that the position offers what the candidate is looking for. And then depending on the position, the hiring manager and the interview team will identify specific characteristics that they believe are needed for this position. And that's what we're trying to get out of the interview as well. And one of the best ways to get that out is behavioral-based interviewing. So behavioral-based interviewing is a concept that I think is really based on the belief that the best predictor of future performance is past performance. So the interviewers will ask you questions trying to get to what you have done in the past, and less about what you would do. So I think all of us could learn how to answer hypothetical questions in a satisfactory way. But we really want to get to some specific examples that either maybe went well or didn't go well, and try and see what that candidate learned from those experiences and what skills they've been able to put into practice, and what skills reflect what they would be able to bring to this position. So that's really what the behavioral-based questions are geared towards, is trying to elicit that specific example from your past. As students or new practitioners, it may be things from your work or intern setting, as well as working in student organizations or different groups for projects in class. Anything that you've done throughout your pharmacy school curriculum can really be applied to these questions. So when we ask these questions, I think a good way to think about how to structure your answer is an acronym, or is EAR, right? So a specific example. So tell me about a specific example answering my question. Give me the action that you took in that example, and then what was the result or outcome. And the teams that are administering these behavioral-based questions are trained on how to ask probing questions to dig a little bit deeper and make sure that they get those things. So make sure that it's a specific example and not broadly applied, and make sure that we get to what was your action. So it's not a generalizable, what happened in this situation, but what did you do in that situation? And then what was that outcome? And whether that outcome is good or bad, I think there's always something that we can learn from those results, and that's something that we look for in those behavioral-based questions as well. So I think it'll be helpful to go through some of these behavioral-based examples or questions, and ask yourself these questions and try and think of examples that you've had in the past that would be good answers to these. So if I was hiring for a position that I felt customer service was a very important factor, a question I may ask is to tell me about a situation in which you had to deal with a patient or healthcare professional that was upset. What was the situation and how did you handle it? So the things that I'm looking for here is a specific example where you were the recipient, right? You were involved in this interaction with either a patient or healthcare professional. It could be somebody that a fellow student that you worked with as well. And then take me through the steps of how you approached that person and how you tried to handle the situation, and then what did you learn from it? A question that would get at the communication skill set would be to tell me about a time when you had a miscommunication with a team member, and how did you handle the situation? And with this type of question, I think I think the first thing is that we're acknowledging that all of us have had some sort of miscommunication at some point in time. So by admitting that, it's not admitting a fault. I think it's just a part of reality. And what I would want to see from a candidate is what you did to try and overcome that miscommunication, and how did you change your communication either with that person or in that type of situation in the future to improve your communication skills. Communication is incredibly important, so talk to me a little bit more about that. no matter what job or type of position that you're entering, there's going to be change. So we may ask a question specifically about change management. So tell me about some sort of significant change that occurred in your previous position, and how did you make sure that that change was successful? So how did you adapt? How did you learn? Uh, what did you do to help others that were struggling with the change? An example question for problem solving could be providing an example when you were given a task with little or no direction, and what did you do to complete the task? So what I would want to see here is take me through your thought process. How did you research the problem? How did you identify what the problem was and what the potential solutions were? And then how did you evaluate those potential solutions, and what brought you to the conclusion for the solution that you chose to complete that task? Teamwork is something that's going to be critical in any setting that you work in. So a question I may ask is, tell me about a time when a team member was not performing to expectations, and what did you do? This is a question that I've seen candidates become a little bit more negative and maybe cast or assign blame to a team member. And that's something that I think is very conscious, or that the candidate should be conscious to avoid. In healthcare, we try and develop systems, right? We don't want to assign blame. We want to try and figure out how to make things better. So tell me, what did you do to help that team member understand what the expectations were? What did you do to make sure that you held them accountable and helped them be successful? Ultimately, that's what we want to see. So when you ask these questions, I think it may be tempting to go down a more negative tone and more negative pathway, but try and be positive, right? You want to leave a positive impression with whoever is asking this question. And finally, prioritization, the last example we have. So tell me about a time when you had several competing priorities. So I'm sure as pharmacy students, you've all had, or new practitioners, you've all had situations where you had a lot going on at the same time. And that's going to happen again at some point in your job or your residency program. Tell me how you're going to handle that, or tell me how you did handle that. And that's what I'm hoping to see, is that someone has the skills to be able to identify what needs to be done today, what maybe they could renegotiate a deadline on another project, or how they could sort through that to make sure that the important things get done and that all of it gets done and everybody involved with those priorities is aware of where you're at. So just take me through how you manage those multiple priorities. So those are some general examples that of behavioral-based questions. I think some general considerations to think about when you are answering the questions. The first one is that it's okay to take a moment and think about an example, which can be very, very awkward. And it can be very stressful when you're sitting in a room with 2 or 3 people and you say, let me think about that for a second. Those 3 to 5 seconds that you're thinking about it may feel like 10 to 15 minutes, but that's okay. It's better to think and try and find a good example. Take those few seconds to think about something rather than to blurt out an example or to kind of ramble on and not have a formulated thought. Also, be mindful of the time spent answering on the questions. So that's one of the tricks and things to balance with behavioral-based questions is you're talking about a real example. You're telling a story of something that's happened. It can be easy or even tempting to expand or to go off and start discussing other factors around that story that may be interesting to you but aren't answering the question. So try and keep that time focused and make sure that you're being respectful of the time and making sure that you're able to answer all the questions that they have for you in whatever allotted time there is. So try and keep that as direct as possible. And as I was mentioning earlier, also trying to stay positive and avoid blame. So some of the questions may be asking about potentially contentious or negative experiences in the past. And I think it's always helpful to find a candidate who was able to stay positive and work through that and make things better for the best outcome. And finally, I think it's okay to have suboptimal outcomes. Things don't always go well, and that's okay. The important part and what I would want to see from a candidate is that they've learned from that. So if your example does have a poor outcome, offer what you've learned, and if you were able to incorporate that learning into something different in the future or a similar situation in the future, that's great, and I would definitely provide that example. So I think we've seen behavioral-based interviewing being more and more incorporated into recruitment and the interview process. I'd like to just talk a little bit more about what interview structures may look like and what some of the additional components may be. So in 2015, AJHP published a survey that looked at PGY1 residencies and PGY2 residencies and identified different components of their interview structure. And as you can see here, I think you can bet on having one-on-one interviews as well as panel interviews. So panel interview being that you have 2 or 3 or maybe even more folks interviewing you at the same time. So I think that's something that can be expected. And I think that's something that you'll definitely see in job interviews as well. A relatively newer interview component is the multiple mini interviews, and this comes from medical school and medical residency interviews. And about 18% of PGY1 programs and 12% of PGY2 programs have used this tactic. And what the multiple mini interviews are is you have different stations of where the candidate rotates through with different interviewers at each station, and you're given some sort of scenario that you need to walk through and answer how you would respond and what you would do. And it may be clinical content, it may be what you would do in a patient care situation, it may be something around an ethical dilemma or some sort of teamwork issue. And there's structured review components that the interviewers are using to evaluate those candidates. So that's something that is, as I mentioned, relatively new, but is definitely being used in residency programs. And then there's the asking candidates to give some sort of presentation. So over 40% of PGY1 programs require that, and about 65% of the PGY2. And this is something that's also incorporated in job interviews. Depending on the position, you may be asked to give a presentation. I think that the things that I would suggest when you're trying to select what presentation to give, first is I think it's always acceptable to use something that you've already prepared, that you've used in the past. I would suggest clarifying if there is any specific requirements around the presentation, whether the program is looking for specific content or duration, just time, to make sure that you're fitting it into the appropriate time. And then, I would try and pick something that you're really proud of and that you're very knowledgeable about. So one of the things that interviewers are going to use with a presentation is you should expect questions at the end. And part of it is to learn more about your topic, but part of it is to see how well you can respond on your feet and how well you know the information you just presented. Are you just reading from the slides, or do you know the background content? So I think it's helpful to refresh that before you give that presentation. And then finally, for the residency programs, you may be given a patient case. So over a third of the PGY1 programs and about 25% of PGY2, the candidates are given a patient case that they need to work up. And I know that can be can be anxiety inducing, but the thing I would remind you is if you're interviewing towards the end of pharmacy school, you've been preparing for this patient case for 4 years. So this is stuff that you'll be able to work through. You've been doing these patient cases through your rotations and throughout your curriculum. I think that the important part and what interviewers really want to see out of this is how well you're able to evaluate the patient and what your thought process is when you're evaluating that, and from the beginning through making a recommendation at the end. And finally, there are some other things that may be a part of the interview, whether it's job fair or residency. You may have a meal with either the interviewers or residents or whoever, maybe dinner or lunch, depending on how long the interview is. Maybe given a tour of the facility, or have some sort of department activity. And I think some folks, when they're doing an interview, they'll have a gathering of pharmacists, of people that you would work with, and just a little bit of time to mingle and to talk with several people from the department that will either be your coworkers or potential preceptors. I think the key thing here is that while these things may feel less formal than the one-on-one or the panel interview, you're still being evaluated throughout all of this. So it's important to keep that in mind and maintain your professionalism throughout your time with the interviewers. All right, so if you've prepared, you're ready, and now it's the day of the interview. It seems pretty obvious, but of course it's important to be professional. So both in your professional attire, it's important to be on time. Make sure you know where you're going and where you're meeting people for that interview, and be mindful of your verbal and body language throughout your interview. I think this is pretty obvious for a lot of people, but one of the things that I will say is particularly if you're interviewing at a place that you're more familiar with, so a place maybe you were an intern or that you had done a lot of rotations, you may feel more comfortable and more casual, but you need to maintain that professionalism. You need to show that you're serious about this position and that that you're not taking anything for granted. And I think that the questions that you have to be ready to answer and to be able to articulate very quickly and clearly are, why do you want this position, and how does this position fit with your career goals? So I think it's always occasionally I've interviewed candidates that aren't quite sure why they want this or can't really articulate why they're there interviewing for that position, and that's always a struggle from the interviewer side. Why I would select that person for that position if they don't know why they want the position. Another important thing I think is to be ready to ask questions. So at the end of the majority of your interviews, you're going to have time to ask the interviewers questions, and you want to have questions ready that reflect both your interest in the position or the residency program as well as the organization. So when I'm interviewing someone and they say that they have no questions at the end, that's a bit of a red flag for me, right? So I want to know that they want to make sure that this position or residency program is a good fit for them, and the only way to do that is take advantage of the time that they have with me and ask me questions. So sometimes if you're interviewing with a lot of groups throughout the day, you may have asked the same question over and over, and maybe you don't have any questions by the end of the day, and it's completely understandable to feel that way. In that situation, I would have some questions ready that you want to ask every person throughout the day. So some things like, tell me why you think this residency program is a strong program, or what's one of the things that you really enjoy about working at this organization or a part of this health system or pharmacy. And finally, at the end of the day, it's helpful to identify the timeline for the next steps. So for residency programs, the next steps are pretty well outlined. If you go through the match process, that's spelled out for you. But if you are looking for a position, it's helpful to clarify that before you leave. If the interviewer or if the hiring manager doesn't tell you a timeline, it's absolutely appropriate to ask, how long do you anticipate before you guys make a decision, or before I hear from you, or is there a particular time that I should reach back out to you if I haven't heard from you guys? Something along that line is helpful to know, just so that you're clear on expectations going forward. And finally, after that interview, what do you do? So I think sending a written thank you note to everybody that you interviewed with is a very nice touch, and it leaves a good impression with all those folks. If you're able to include anything that's specific to your time with that interviewer, that's also a very nice touch. So if you remember the interviewer talking about their favorite part of working as a part of that pharmacy. Let's say that person really enjoyed the patient population that they work with, including that in your thank you note will just help them remember a little bit about you and their time with you. It's also helpful to follow up, you should definitely follow up as instructed in the interview. So if they do outline and say, if you haven't heard from me in 3 weeks, then contact me again. Do so. Write that down as you're leaving the interview or as soon as you have that, just so you can keep track of that. And then communicating any personal timeline. If you're in a situation where you do have competing offers for multiple jobs and the job you haven't heard from is one that you're really interested in, it's completely appropriate to contact the hiring manager and say, I've been offered another position and I have 3 days to respond to them. I'm very interested in your position. Is there any information that you can provide me to help me consider my options or understand what my options are? I always appreciate that from the hiring manager side because things happen, timelines may change. If there's a candidate that I know is a good fit, and I know that they have a timeline like this, it gives me an opportunity to make them an offer and to maybe work on my side to speed up our timeline to make sure I get the right person in that position. So hopefully we've covered some good tips and strategies for preparing for interviews. I have my contact information here on the final side. Please feel free to contact me if you have any questions about this presentation. And thank you very much. So I have a question from the room here. So the question is, would you ask about salary during the interview? And I would say no. I think particularly, we're in pharmacy and we are a profession. I think the time to ask about that is when you get the offer. I think, yeah, the other things as far as fit and does the position align with your goals should be your focus during the interview day, and you don't want to detract from that by asking about salary. Good question. All right, thank you.